Have you ever felt so tired that even a full night's sleep doesn't help? Or maybe you've noticed you're losing weight without even trying. While these can be signs of many things, for some, they could point to a rare but serious condition called Addison's disease. Today, we're going to dive deep into what Addison's disease is, what causes it, how it's diagnosed, and most importantly, how it's managed. So, what exactly is Addison's disease? Put simply, it's a disorder where your adrenal glands, which are these small glands sitting on top of your kidneys, don't produce enough of certain crucial hormones. Specifically, we're talking about cortisol and often aldosterone. You might have heard of cortisol as the stress hormone, but it does so much more. It helps your body respond to stress, maintain blood pressure, regulate your immune system, and manage how your body uses fats, proteins, and carbohydrates. Aldosterone, on the other hand, balances sodium and potassium in your blood, which helps control your blood pressure. When these hormones are in short supply, it can throw your whole body out of whack. The symptoms of Addison's disease usually develop slowly, over several months, which can make it tricky to diagnose at first. You might just feel generally unwell. Common early symptoms include extreme fatigue that doesn't get better with rest, muscle weakness, and unintentional weight loss. You might also lose your appetite and feel nauseous, maybe even vomit or have diarrhea. One of the more unique signs is hyperpigmentation, where your skin becomes darker in certain areas, like on scars, skin folds, elbows, knees, and even your gums. This happens because the hormonal imbalance can increase the production of melanin, the pigment that gives skin its color. Other symptoms can include low blood pressure, which might make you feel dizzy when you stand up, salt cravings, low blood sugar, and mood changes like irritability or depression. So, when should you see a doctor? If you're experiencing a combination of these symptoms, especially the persistent fatigue, muscle weakness, and skin darkening, it's definitely time to make an appointment. Don't just brush it off as stress or aging. Now there's a more serious situation called an Addisonian crisis, or acute adrenal failure. This is a life-threatening medical emergency. Its symptoms can appear suddenly and include severe pain in your lower back, abdomen, or legs, intense vomiting and diarrhea leading to dehydration, a sudden drop in blood pressure, loss of consciousness, and high potassium levels. If you or someone you know with Addison's disease shows these signs, you need to seek emergency medical help immediately. What causes Addison's disease? The most common cause, accounting for about 70 to 80% of cases, is an autoimmune response. This is when your own immune system, which is supposed to protect you from infections, mistakenly attacks your adrenal glands, damaging them to the point where they can't produce enough hormones. We call this primary adrenal insufficiency. Other less common causes of primary adrenal insufficiency include infections like tuberculosis, cancer that has spread to the adrenal glands, or bleeding into the glands. There's also something called secondary adrenal insufficiency. This happens when your pituitary gland, a small gland at the base of your brain, doesn't make enough of a hormone called ACTH. ACTH is the signal that tells your adrenal glands to produce cortisol. Without that signal, the adrenal glands shrink and stop working properly. This can be caused by tumors on the pituitary gland, surgery, or radiation. Let's talk about risk factors. While Addison's disease can affect anyone at any age, it's most common in people between 30 and 50 years old. Having another autoimmune condition, like type 1 diabetes, vitiligo, or an underactive thyroid, can also increase your risk. A family history of Addison's disease or other autoimmune disorders is another factor to consider. If left untreated, Addison's disease can lead to serious complications, the most dangerous being the Addisonian crisis we just talked about. This is why getting a proper diagnosis is so critical. So, how do doctors figure it out? It usually starts with a review of your medical history and symptoms. If your doctor suspects Addison's disease, they'll order blood tests to check the levels of sodium, potassium, cortisol, and ACTH in your blood. A key diagnostic test is the ACTH stimulation test. This involves getting an injection of synthetic ACTH and then having your blood drawn to see if your cortisol levels rise. If they don't, it indicates that your adrenal glands aren't functioning correctly. Imaging tests, like a CT scan of your abdomen, might also be done to check the size of your adrenal glands and look for any other abnormalities. The good news is that Addison's disease is very treatable. The goal of treatment is to replace the hormones your adrenal glands aren't making. This typically involves taking oral corticosteroids, like hydrocortisone or prednisone, to replace cortisol. You'll need to take this medication every day for the rest of your life. The dose might need to be adjusted during times of stress, like if you have an infection, are having surgery, or experience a significant emotional event. If you're also deficient in aldosterone, you'll be prescribed a medication called fludrocortisone to help balance your body's sodium and potassium levels. People taking fludrocortisone are often advised to increase their salt intake, especially in hot weather or after heavy exercise. It's absolutely vital for anyone with Addison's disease to carry a medical alert card and wear a medical alert bracelet or necklace. This informs emergency personnel about your condition, in case you're in an accident and can't communicate. It's also wise to keep an emergency kit with an injectable form of corticosteroids for use in a crisis. Your doctor can teach you or a family member how to administer this shot. Now, what about alternative medicine? While some people explore complementary therapies for managing chronic conditions, there's no scientific evidence that any alternative treatments can cure Addison's disease. Hormone replacement therapy is the only proven effective treatment. It's crucial not to replace or delay conventional medical treatment with unproven methods, as this could lead to an Addisonian crisis. Living with a chronic condition like Addison's disease means making some lifestyle adjustments, but you can absolutely live a full, active life. It's all about management. It's important to take your medication exactly as prescribed and never miss a dose. Keep in touch with your doctor for regular checkups to monitor your hormone levels and adjust your medication if needed. Learn to recognize the signs of an Addisonian crisis and know what to do. Try to manage stress in your daily life through techniques like meditation, yoga, or hobbies you enjoy, as stress can affect your cortisol needs. Eating a balanced diet and getting regular, moderate exercise is also beneficial for your overall health. Living with Addison's disease requires diligence, but with the right treatment and lifestyle management, you can control your symptoms and prevent emergencies. If you've just been diagnosed, it can feel overwhelming, but connecting with support groups, either online or in person, can be incredibly helpful. Hearing from others who share your experience can provide emotional support and practical tips. Thank you so much for joining me today to learn about this important topic. If you found this video helpful, please give it a thumbs up and don't forget to subscribe for more health and wellness content. Stay safe, stay informed, and we'll see you in the next video.